kind of lose a lot when you're like first, second grade, and then you take a break for a couple years till you're about in 5th grade-ish, and then you start losing them again. So.
Well, she lost a lot of her teeth really early too.
Really early. Oh, so you might start earlier. What grade are you going to be in next year? You might start losing them next year.
Yeah, she had most of her teeth out before she started first. So.
Oh, yep, you were an early bird. So more than likely you're going to be an early bird on the other ones too. So. For me, and my fingers in there, but don't bite on it. Just bite your teeth together. Perfect. Just hold still as a statue. Nothing in there right now. I'm going to put like a little paper in there. And this, you're just going to bite on this, and this is going to go by your tongue, okay? It's not the best feeling, but bite all the way down and hold still as a statue. Good job. And open. Pretty easy, huh? All right, other side. Same exact thing. Bite together. And open one. 1 second. Let me get you. No, that one's off. Okay. Your leg. Perfect. Hold still as a statue. And open. Perfect. Got him. Easy peasy lemon squeezy. Was it easy peasy lemon squeezy? Okay, good.
How was it? All right.
You just want, you want it? Okay, there's channel up and down right there, okay? So I'm going to raise you up just a little bit. You don't have to do anything. I do it all with the chair.
Turtle charge it, 700.
Are you ready? Get your teeth all sparkly clean.
All shiny. Okay, so I'm just going to look around and start off, okay? I've just got a little mirror. And I know sometimes people think this is scary because it looks kind of sharp, but it's just a tapper. So let me show you on your front teeth. It just kind of taps on the top of the teeth, and that's how we check them, okay? So it's pretty easy that way. All right, so let's open wide. I'm just going to look around. Yeah, kiddo, you are done losing baby teeth already. You are super early for that. Well, no more tooth fairy for you.
Tooth fairy hasn't come since she was 4.
Mm-hmm.
We had to have a talk. I couldn't keep up.
Got some sealants on those teeth. That's good. Do you know what sealants are?
Marissa?
Marissa, do you know what sealants are on your teeth? So it's just a protective coating they painted on top of your teeth and all the little grooves and cracks on the top to keep you from getting a cavity, and you have them on most of your back teeth.
Pretty easy to install. Yeah.
You've got pretty nice teeth, kiddo.
The shift points and stuff on it.
All right. So we're just going to go around and do a little scrubbing, okay, with my instruments here. So sometimes I kind of bounce on your gums. You can kind of feel it, all right? But just let me know. You can raise that left hand if it hurts at all, okay? It shouldn't hurt. Sometimes it might be a little bit sore. I'm going to kind of pick at this one because it's a loose sealant. There we go. Just can kind of feel me by the gums.
It does have a crack in part of it. The last tooth, no, actually they both seem to have a little bit of that how it expands in the tooth. Took that phone for a moment. No, I'm good. All right. We used to watch the news. You want to text? That's about as stressful as you get, so. So I'm good.
I think we're gonna have to stop beating around the bush and just get into Iran and get our hands dirty. Coming. Alright, open a little big and have your left hand ready. If anything bothers you, just raise that hand, okay?
Open big for me. Good job. Oh, you can close just a little. Sometimes if you open too big, your jaw gets tired a little too quick. No sore on that one. You might have little sore areas every so often. Just that one? Okay. We're going to put some water on there and rinse you out, okay? So, the suction will grab the water, okay? Just a little water coming. And go ahead and close your lips. There you go. And open. Pretty easy. Does that make it feel better? Yeah. Open big. So sometimes where it's sore is actually where you need to brush a little bit better. And that's kind of the case down here. You have a little bit of tartar buildup, and it's causing the, right there, I know. Let me get that tartar out of there. There we go. And it makes it a little bit sore. But we'll get it cleaned out, and then you brush it really well and floss, and it'll go away, okay? I'm not meaning to get you, Kevin. Just kind of feeling catching on something there and having to get it. That's a little bit of tartar. So that's hard stuff that you can't brush off anymore. Sorry, I'm sure my big head's in the way of the shoulder. Oh. Nothing more. Does it hurt or is it weird feeling because it feels tight? It hurts? Okay. Because there's times like right there, can you feel how it's kind of tight? Because I'm trying to squeeze in between your teeth and gums. Or not your teeth and gums, between your two teeth. We're almost done with this front part. You've been doing great. Okay, we'll give you some water in there and rinse it off. Better? So when I floss there, it might be a little bit sore too, okay? That's the only area I think will be sore though.
Do you ever sometimes feel like you're a capuchin monkey?
My aunt actually sent me like this meme one time with like a hygienist or something and like picking on the,
That's hilarious.
I'm terrible with my kids though too, like if they have boogers or anything. I can't. You want to see what the plaque looks like? No? I'll show you. This is off of one tooth in the back. So it's just kind of a white chalky. Have you ever taken your fingernail and scratched your tooth and got that off? Yeah, it's just plaque. So it's like a soft. It's really soft. So that's what you brush off with your toothbrush. So that's why it's important, because you can brush that off. But if that sits on your teeth too long, you know how that hard area up front that you could feel was a little bit harder, then it turns into tartar, and that's what that is, and you can't brush that off anymore. So that's why it's important to get your teeth brushed 2 times a day. It looks like you do a pretty good job brushing. It's been a little while since you've had your teeth cleaned, so that's actually not too bad a buildup for a couple years.
Okay, your son wants to join the party, so we're gonna try to put some cotton wool down here and put it off this too, so it's a little. Pull it up.
You don't think braces are in our future at all, do you?
She actually, I was gonna say, she looks pretty good. She's got a little bit of crowding, but as she gets bigger, that might settle in. Bite your teeth together in the back.
Because I did notice that one tooth is a little bit
That
not.
one lost that. Yeah, she's not too bad. Nothing that, you know, couldn't wait till maybe she was a little bit older too. So.
But they're not, braces really aren't recommended until after 12 though, right?
It depends on the situation.
Okay.
So some kids, yes, if we have a crossbite or a narrow palate or something like that, which is usually crossbite is narrow palate, then it's indicated really early, but that's not her case. That's where, so bite down again so your mom can see this. See how her back teeth on top overlap her bottom teeth? That's the way it's supposed to be. A crossbite would be if the bottom ones overlap the top ones.
Oh, okay.
And so the reason we want early intervention for that is we want to actually expand the palate, and the roof of the mouth, the hard palate, has a fissure in it that's not, it's got cartilage. It's not keratinized yet, or the bone hasn't, but it does over time. It, bone, so
Tightens
when
up
they're
and
young,
hardens.
yeah. So when they're young, you can actually pull it apart and make their
Mouth
maxilla
bigger.
bigger
Oh.
before. But if you wait too long, it's calcified and you can't do it anymore.
Oh,
So,
okay.
so sometimes early like we'll send kids at 7 and their parents are like, oh, they don't even have it. And it's like, no, it's not for that. It's for the bite, for something later, where later on you're talking oral surgery, breaking the jaw, rearranging stuff. So,
Right.
and that's such an easy thing that they click and just move the jaw part a little bit each day. So,
Gotcha.
all right, easy part now, polishing. Okay, what flavor? You get to pick. I have mint or vanilla or tangerine, which is kind of like orange, or strawberry or bubblegum.
Bubblegum.
Bubblegum? Okay. In there, just let me. So I want you to see what it feels like. So, but I'm polishing. It kind of tickles. That's basically what it does. But it's kind of weird looking. It's like a really good toothbrush, and I put that toothpaste. Now the toothpaste is kind of sandy gritty too, okay? But I'll rinse it out of your mouth and use the suction and stuff, okay? So you just let me know. Usually I rinse it about halfway through, but if you need more rinsing, you just tell me, okay? Now, did your son was this an issue, the grittiness, the texture? How does he do with toothpaste at home?
Not bad, really.
Okay.
So
we might switch to toothpaste. To
and
polish.
that's kind of what Dr. Woods started to switch to, but he was able to get everything
Yeah.
just quick, so.
Because this is definitely, usually it's a texture thing, and this is definitely a different texture. You're going to feel like you.
Right. You add that weird vibration plus the texture, and he was like, nope, not having that.
It kind of tickles, huh? I think, wait till we get to the top. It's really ticklish on the top.
So I was wondering if maybe to help continue to desensitize them, if I should get an electric toothbrush and start using that
That
too.
might be, yeah, something great. And actually, they do a great job with cleaning their teeth, too.
Okay.
So.
Just kind of get them used to that vibration.
Okay, but I will let you close on that and get the extra out of there. Good job. Open. Okay, and open big like an alligator. I'm going to push your tongue out of the way just a little bit. Real quick. This is where you really get the sandiness and feel it and taste it. I guess you can't taste sandiness, but it's just kind of sandy. Yeah, I had one patient and he hated polishing and I just couldn't go ahead and close. And we finally figured out it wasn't anything, it was the flavor. And he'll
really?
just use plain pumice, yeah, which I think tastes terrible, but he has no problem with it. He didn't want any flavor with it. And then it was totally, once we figured that out, he's totally fine.
Well, that's good.
Yeah, so.
We all just have kind of different preferences for sure.
Yeah. Go ahead and close. And open. But usually with this, it's a texture thing for sure. So. But you don't have any problem with the sandiness, huh? This is kind of gritty. I try to rinse it really well. Go ahead and close. But I'm going to do it all over on the top teeth now. Alright, open wide for me. So this is kind of the ticklish area, I think. Because your tissue's really tight on the roof of your mouth, so it can be kind of ticklish. Open just a little bit wider for me. Perfect. Is that kind of ticklish? Yeah. I even have adults wiggle around like they're getting tickled when I do the top ones. Some people are really ticklish there. And it's not an easy area to scratch once it gets tickling too. Okay, go ahead and close, get that extra out of there. A little bit more on the outside, and then we're done with that. Close. 3 more teeth and we're all done, okay? What happens is you start salivating, making more saliva, because you get the flavor and your brain thinks you're getting food, so it gives you can start producing more saliva. I gotta get all that spit out of there. Because you know your saliva helps you digest food. Did you know that? It starts in your mouth even before it hits your belly. Open my nose again. And close. Okay, I'm going to give you a little in your mouth. Kind of hard to do, but kind of swish that around, get all that extra out of there. And then just open your mouth when you're ready and close. Perfect. All right.
I've often wondered if this is the same nitrous that they use in vehicle to get it. Is it the same?
Get it off your lips. Okay, so we're gonna floss now. Remember I said those bottom fronts might be a little bit sore to flossing, right? Because they were a little bit sore when I was cleaning them. They shouldn't be too bad. But it's real important for you to try to floss a little bit, okay? And it's hard. I recommend those little flossers, pre-floss flossers. Have you used those, the little sticks? Those work really well, okay? But it takes a little bit of practice. See, I'm not good with those on myself. I do much better with normal floss, but I've got a lot of practice with normal floss. Okay, and that's one thing when you do it, hun, it's going to be sore because you haven't been doing it regularly. And so it's going to be a little bit sore to start out. So, but if you keep doing it, that'll totally go away, okay? And I bet yours goes away in just a couple days if you did it, because your gums aren't too bad at all. They're pretty healthy. Just a little bit in the front, which, is she a mouth breather at all?
I don't think so.
Okay. She doesn't look like, usually it's really inflamed in the front, but sometimes where it's more in the front that it's inflamed. Like on her, it's, and kids are notorious for kind of being mouth breathers.
So we've got 2 more on your upper left, 2 miles of length for replacing. And then we've got 2 right up front. And then 1 by itself on the lower right. So, if any of those bother you, we'll go after those first, but yeah, man, I don't think it really.
I know after like 3 days after you did my cleaning, I wanted to come in and do it again. I've missed that, like, that feeling of
Nice
like,
clean.
Oh, yes.
Do you have an electric toothbrush?
Get an electric. I probably should get one.
Yeah.
That'll
you
give me that
you almost
feeling.
get that feeling. Yeah. Yeah, you do. So. All right, good rinse. So we're pretty much done. Was that hard?
And we might be able to do that.
Marissa.
Was that hard? We're pretty much done. Doctor's just gonna come look at you, and then we'll put some fluoride on your teeth when he's done looking. Okay? You did great. I'm gonna leave you laying down so you can watch TV.
canines?
Even canines.
Wow.
Yeah.
That usually doesn't happen until you're 12.
Yeah. And she's yeah.
I'm gonna do the exercise with you right now.
All right. So when doctor does the fluoride, Marissa, what flavor of that? I have mint, melon, caramel, or cherry.
Cherry.
Cherry? Okay. All right, after doctor's all done, you can eat and drink right away, so that's one good thing. See, when your mom and I were growing up, we had to wait half an hour to eat or drink anything after we did fluoride. I know.
Yeah,
So you can eat and drink.
That was in Girls Club too.
Perfect. So these are things I don't want you to eat though. Like carrots or celery or apples, you know those hard crunchy things you bite into? I don't want you to eat those just till tonight, just today. Okay, after tomorrow you can eat whatever you want again. These are just rules for today. I don't want you to eat anything sticky, caramel taffy gum, fruit snacks, just today, again, okay? And I want you to wait to brush your teeth till right before bed tonight, okay? We want it on your teeth for 6 hours, so I'm pretty sure you probably go to bed later than 7:30, so I think we're pretty safe there.
Yeah, it's supposed to be at 9:30.
9:30.
Homework.
But
Can I
they
just get up in the chair for
they
me?
push it until 10.
I was gonna say summer hours. I realize that.
I'm like, oh, no time for homework.
Okay. Open really big for me. Can I have you tip your head back for me, chin up? There you go, perfect. And open super humongous. So she's got a ceiling on 3 and 5.
Yeah,
Not
she's
4.
got premolars still pretty good.
12 has a ceiling, 13 does not. 14 has one. Kinda.
I wonder if she missed, because some of the
Open,
molars
open.
have partial sealant.
19's got a seal on it. 20 does not, 21 does. I would bet when she got those, maybe the second premolar hadn't erupted yet.
Did they have a sealant clinic at school? Or-
Yeah.
Yeah. I was gonna say, because there was no way 2 years ago she had those teeth, some of them, so.
Number 30 has a ceiling. Didn't see the local pet, that's too bad.
They did, actually.
Did they?
Uh-huh, I popped it out because it was loose.
No, it's probably starting to decay under there. I'd put a watch on number 30 buckle. It's almost a cavity. And I put a watch on 19 buckle. It's just a hit on both of those, how they formed.
So what he's talking about is when the teeth form, they form in lobes and they kind of come together, and where it came together on the side of her tooth, it didn't totally come together like this.
Okay, now
There's
shoot,
kind of a
shoot.
little
I
pit
got it.
on the side, makes it more susceptible to getting a cavity.
Cavity, right.
Yeah.
Because
So
food
it's
gets
nothing-
trapped.
Yeah. So it's not really anything she's not doing or doing that caused it.
So she would probably benefit from braces at some point, not because her teeth are crooked, they are a little bit, but not enough to worry about. It's her overbite. So typically when teeth come together,
Uh-huh.
you've got 1 or 2 millimeters of overlap, and hers are like this.
Oh,
So you
okay.
can't even see her lower teeth when she bites all the way down. Bite down all the way. You shouldn't see part of them, but normally you'd see a lot more. So to correct that, they typically will extrude the molars a little bit, and it opens around to your bite.
Oh, okay.
So something to consider. Will certainly be beneficial in the long run, but in her case, I don't think it's super critical.
Do you feel right for me? I can do it. I can.
I can do it.
Oh.
I just forgot. So we picked up cherry. I've never tried this flavor. You'll have to tell me what you think.
Okay, well, he's getting out. Which toothbrush would you like? Okay. I kind of thought so, so I just went and got it, so I was all out of that. Yes.
Well, we're gonna be done in about 30 seconds.
Yeah.
No,
Yeah.
10 seconds.
Sorry. Something
Turn-
good, huh?
Super. Oh, it's the music board. Turn towards me a little bit. Okay, now stay open for me.
Do you want to get her set up for 6 months for an appointment?
Yeah, that would be great.
Is there a day or time better for you?
Morning preferred.
Okay. So right now we're actually with spring break, not spring break, Christmas break.